Unionised workplaces are safer workplaces. And today, on International Workers' Memorial Day, we remember the dead and fight for the living. Every year, worldwide, more people are killed at work than in wars, and we're here to honour and respect those who've lost their lives at work. 2018 is the year when we celebrate 40 years of union health and safety reps. The thousands of health and safety reps across workplaces in Wales help to reduce injuries at work, which leads to a reduction in the levels of ill health caused by work. It encourages greater reporting of injuries and near misses, makes workers more confident, and helps to develop a more positive safety culture in the organisation and saves the economy many millions of pounds. Put simply, safer workplaces are one of the main reasons why people join and stay in a union. When asked, 70% of new trade union members considered health and safety a very important union issue, even more than pay. Unions were the first to raise major concerns over levels of violence in the workplace, repetitive strain injury, asbestos and the effects of passive smoking. And when unions first raised the issue of stress, which can lead to poor mental health, employers and the media argued it was nonsense. It's now recognised that workplace stress affects 27,000 people in Wales. Health and safety protection is crucial, as during 2016 to 17, 10 people died in Wales because of their work. Most died from cancers, lung diseases and heart problems, rather than being killed at work, but their deaths are just as tragic and preventable. And it's not just the number of deaths that's an issue, but the numbers of people made ill or injured by their work. In Wales last year, workers suffering from work-related ill health amounted to 68,000 workers. Most workers don't die of mystery ailments or in tragic accidents. They die because an employer decided their safety wasn't that important. Workers' Memorial Day commemorates those workers, and so if you're not in a union, join a union. If you're a member of a union, become active and become a union health and safety rep. You can help change the safety and welfare of your fellow workers.
Let's talk work. We all want to work somewhere that's good for our health, but what's the best way to make that happen? You could eat your weight in kale. Maybe you could listen to whale music at your desk. Or you could join a trade union, because unionised workplaces are safer workplaces. Maybe you've been campaigning for showers to be fitted so you can cycle to work. Perhaps you've pointed out a trip hazard to your manager, but nothing's been done about it. Or maybe it's about getting the temperature right in your workplace, a desk chair that supports your bad back, or even accompanying you to that stressful meeting with your boss. Your trade union is by your side, making your workplace safer and healthier. There's plenty of evidence to back this up. Injury rates have been shown to be lower in unionised workplaces. Health and well-being are also improved with lower illness rates in workplaces with a higher proportion of union members. Because health and safety is not about red tape. It's about making a better, safer, healthier work environment for us all. Trade union safety reps are the most effective tool that we have in ensuring good health and safety at work. We now have an army of safety reps throughout Wales that are working tirelessly to reduce injuries and ill health caused by work, encourage greater reporting of injuries and near misses, and developing a more positive safety culture in workplaces. Health and safety reps are making workplaces safer whilst saving the economy millions of pounds. By joining a union, you join a movement. Your trade union can help you make the changes you want to see at work, whether that's about making sure you and your co-workers benefit from mental health training, if you need better equipment to help you do your job safely, or if your workload is just too much. Your union is there to help make your workplace better and safer for everyone, which is why unionised workplaces are safer workplaces.
I'm Mike Jenkins, the President of the Wales TUC. And I'm Julie Cook, National Officer at the Wales TUC.
This International Workers' Memorial Day, the trade union movement in Wales remembers all those who've lost their lives at work. Last year in Wales, 10 people lost their lives because of an incident at work, and many more died from injuries and illnesses related to their job. We remember them today, along with the many thousands more who shared their fate throughout the world. Each one of these people had a family, friends and colleagues who are now missing a loved one. There is no more basic human right than the right to go to work in the morning and return home again at the end of the day safely. For too many people, work itself is a hazard to their health and well-being. We must stay firm in our resolve that one life lost to a job-related incident is one too many. But today is also about fighting for the living. As a movement, we remain resolute that each one of us owes it to those workers to win this fight. It's trade unions who use our collective voice to ensure that awful accidents are prevented from happening in the first place in Wales, the UK and throughout the world. Unionised workplaces are safer workplaces, and by joining our trade union movement, you only make us stronger.
It's our health and safety reps who lead this fight by demanding safer working conditions for all. And this year marks their 40th anniversary in the workplace. Who else other than our workplace reps who day in and day out fight for better conditions for their colleagues and ensure support is there when it's needed the most. Today we remember the women and men taken from us too soon. And we also thank our trade union health and safety reps who are making the workplaces safer for everyone.
I'm Jackie, and in 2012 I was given a diagnosis of terminal secondary breast cancer. It actually came as quite a shock to me because I've always been an exceptionally healthy person. It's very difficult to describe how devastating and frightening it is, and it's actually quite remarkable who actually isn't there to support you. I actually wanted to carry on working as work was a big part of my life for various reasons: dignity, stimulation and also money. So I was pretty shocked at the time when my company didn't really take any great care and attention to me, didn't give me any support emotionally, and we then started to have problems. HR's words to me was, I need to talk to you about how your illness will affect the company and not how can we help you. At this point, I then went to my union, the GMB in Nottingham, and we then got my company back on track. I've met an awful lot of people who are coming to terms with their terminal diagnosis, and they also have had problems at work. Some employers have actually dismissed them, treated them very badly. This is what actually started me thinking the law is not working properly and we need to change things. So with the help of the trade unions, various charities and other organisations, we are now launching the Dying to Work campaign. The Dying to Work campaign is about people who wish to carry on working after a terminal diagnosis. It's about giving them choices. Do they want to work or do they not want to work? It's about giving them the additional protection that actually is not there at the moment. It is about making their experience stress-free and giving them security. When I was at my most vulnerable time, I was very stressed and I felt very isolated, and my union was there with me all the way. What I want to do now is to make sure no one else goes through what I've been through. Changing the law isn't going to help me now, but I want it to help everyone who comes after me.